brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Scars come in all shapes and sizes. If you're an adult, you've probably got a few that serve as reminders of when you fell off your bike when you were a kid or when you injured yourself during a sporting event. Many scars stay with you for life, evidence of an injury that occurred. Tonight we go beneath the surface to learn about scars and wound healing. Express Care's Dr. Jitka Lom joins us now in studio. Thanks, Doc, for coming in as
You're
usual.
welcome. Thank
Now,
you.
what exactly is a scar?
Well, a scar is a response to an injury. So whenever you injure your skin, especially if you have a cut or a wound, your body has natural healing tendencies. It's really quite incredible where bridging will occur between the two edges of the wound. The skin will re-heal, and it will not be perfect like it was before, but you'll have a reminder of the injury.
Now, what causes it? What causes the scarring? So you injure yourself, and then you know, when your body is putting itself back together, so to speak.
How does it happen? So it's really amazing. So if your wound is about 1 millimeter apart, if you have a cut and it's just you know, close together either through stitches or the wound just isn't gaping, then within 24 hours your body can make little bridges from one side of the wound to the other. So you'll have like a little scaffolding of something called fibroblasts kind of holding the skin together. And then what will happen is that the top layers of cells migrate across, kind of making like a little seal. So within 24 hours you're going to have a little bridge underneath and a little seal over top holding that wound together, and then everything in between needs to fill in. And so for a typical cut or a wound, on the face it's very quickly healing. Within 5 days your wound will be pretty much healed. On the body, 7 days. Longer if you're diabetic or you have some other health condition, or if it was a very huge cut. But it is really a remarkable process.
Now, I understand that there are different types of scars. What are they? Can you explain those?
Yes. Well, one type that you have is called an atrophic scar, and you've seen this on people, especially with acne scars, where they look like they have deep pits. It looks like there's some skin missing, sort of like a little cup or something. The skin's kind of thinner. That's one type, where the skin is healed, but it's not as plump or thick. Then there are the thicker scars. The best kind of scar is a flat, nice scar. But then there can be thicker scars called hypertrophic, where they're just basically a little bit of a lump there. And then we have the very extreme, which is a keloid scar. And keloids are huge growths. They can basically become very, very large, almost like a tumor. And they can be itchy and painful, and they're growing. So for a normal scar, your scar wound healing process will be finished, you know, the initial part within 7 days up to 1 year for full remodeling of the scar. But with a keloid, it will continue to grow. So you might have had a tiny cut or even a pimple 5 years ago, but your scar is still growing.
Wow.
Yes.
Okay. And you did briefly touch on it, but how long does it take for a scar to fully mature? I mean, I think a lot of times, you know, you cut yourself and you think, oh, in a week it's been healed. But what most people don't realize is that it's actually still maturing.
It is maturing. It takes a full year. And there's basically a little remodeling going on there all the time, where cells are going in and saying, well, not quite right, let's just fix this up a little tiny bit, make it a little stronger, reorganizing, color changing. So unless you've given your scar a full year, then don't judge it yet.
Okay, now, are all scars a result of wounds, burns, surgeries, or accidents? Can skin disease also result in scarring as well?
It can. So you're talking about the external forces that will injure our skins, such as burns and cuts, but we also have internal forces that can hurt us. Typically you'll notice from boils that people may have a scar that's residual, or from acne, or if there's been a disruption of blood supply to the skin, for example in a diabetic with an ulcer of the foot. The reason they got the ulcer was there wasn't good circulation that went to the foot, and they got infected, and then there can be a wound there. So we have internal forces and external forces that affect our skin.
Are there some areas of our bodies that are more likely to scar than others?
Yes, the areas that are really most prone to scarring are the areas over the joints, or the areas that are constantly moving. So for example, I'm just thinking, if you cut your lip and you're constantly talking, you're going to have more chance of a scar there, or over top of your shoulder, on a finger, wherever there's constant motion, because part of wound healing is that it needs to rest so that those edges can be close together. If the edges are constantly moving, then it's harder for the wound to heal.
No, I guess the biggest question is, once you get these scars or you have some sort of wound, how do you get rid of them?
Right. So ideally, you would take good care of your wound right from the beginning, mainly preventing inflammation and most of all infection. If you get a lot of infection in your wound, you're going to get a worse scar.
Right.
So you want to try to keep your wound very clean and dry. One big mistake that people make is they put peroxide on their wounds. Please do not do that. If you cut yourself, only at the very beginning should you ever use peroxide, because it kills healing tissue. So you want to use it possibly just to clean your wound at the very beginning. Best is just soap and water. Rinse it out with soap and water, and then take good care of the wound by washing it twice a day, covering it with a dressing or a Band-Aid, and then letting it do its own natural process of healing. You don't really need to put a lot of stuff on the scar. But to answer your question, once you've already had a scar for, let's say, a year or two, what can you do about it? Sometimes it's very difficult, because scars, we judge them by color and texture. If it's a brown scar, let's say it's discolored, we can help that with sometimes lightening creams, sometimes with laser. If it's texture, meaning that the scar is, let's say, raised, or it's depressed, or it's lumpy in some way, then we need to try to work on the collagen, which is that fibrous tissue underneath the top part of the skin. And sometimes we can work on it with injections. Sometimes we can work on it with needling and bringing more blood supply to that area. But oftentimes texture is very difficult to treat. So whatever you do with scars, it takes time. Again, whatever intervention we do, we wouldn't judge it for a whole year after we've done it. So it can be a challenge.
So no hydrogen peroxide.
No hydrogen peroxide. And one other thing is, if you have a wound or a scar and it's already healed a little bit, protect it from the sun, because the sun will discolor it, tan it. That skin is way more sensitive because it's brand new, fresh skin, and it will be more sensitive to the sun's rays. So it'll turn dark and also be more prone to skin cancer. So you want to wear sunscreen and protect your scars.
All right, good to know. Thank you, Doc, for that information. We will get more advice from Dr. Lom after this quick timeout. Stay with us.